Hey guys, Jim Hoffman here for EMS Office Hours. This is, of course, the Monday Minutes for the week. Hope you guys had a great Easter. Today we're leaving neonate stuff and pediatrics, and we're going to get into geriatric. And this is going to probably be about a three-part session here. But part one, I want to kind of focus on issues with falling, changes, okay, of their sensations and stuff like that, and kind of a general assessment, okay? Before I do get into that stuff, guys, as always, why is this stuff important, right? I always try to answer that and try to kind of bring to light why this information is important. Now, these are very quick videos, right? But it's made to give you that key information, those key points that you'll often see on exams, okay? But it's not just for exams. It's to build your knowledge, okay, to get you more comfortable with your decision making, okay, to get you more well versed, okay, in this content, and to help you make better clinical decisions, do your reports better, and interact better with other healthcare professionals, okay? So while this is key information, I'm hoping that it encourages you that if you don't understand something or you want to know more about it and to get a better mastery of a particular kind of topic during these sessions, you're going to crack open that textbook, you're going to do some Google search, maybe you use a resource like my Paramedic, okay, to go ahead and research more and get your knowledge base up there, okay? That's going to help you, like I said, not just do exams, but be a better clinician out there in the field. Okay, so talking about the geriatrics, and let's talk a little bit about the history of falls, right? A lot of geriatrics have histories of falling. So you got to look at things like CNS disorders, right? Things like previous CVAs, things like dizziness or weakness, things, medications that they might be on, even their vision might be impaired, okay? So investigate a little bit, okay? Try to find out if they have a history of falls and what those are actually causing, okay? Because that is a big indicator for our geriatric population that there's something else that might be going on with them, okay? Now, talking about things like common issues, right? We talk about common issues, especially with falling, right? What are some of the common problems with geriatrics, right? Because of them falling, they end up having reduced mobility. They don't eat as well, okay? Because they can't get up and prepare their food as well as they would like on their own. They end up having difficulty moving their bowels, going to the bathroom, right? And cleaning themselves, okay? They can have things like just basic, skin abrasions, right? Injuries from falls, right? Even circulatory compromise occurring from those injuries, all right? And the fact that they're falling and they have falls in the past, they often end up having a decrease in their medical compliance, meaning their medications. They're not taking their medicines like they're supposed to. They're not going to the doctor appointments that they're supposed to be going to, okay? All these types of things are common problems that you'll see due to the fact that your geriatric patient falls, okay? These are all the different types of things that kind of tie into that. So while falls are really a simple call for us as EMS professionals, it's really a bigger issue when it comes to us treating our geriatric population. Now, I want to talk a little bit about some of the changes in geriatrics when it comes to their sensation, all right? It's a little different for them when it comes to what they experience as opposed to us, right? Their vision, let's say, okay? They get cataracts on their eyes, glaucoma, and it is a problem as well. That's that high ocular pressure, okay? And that can lead to vision loss. Their hearing loss can cause a barrier to them, right, to getting proper treatment, proper care. Their speech, sometimes their physical and mental changes can impair their speech as well, right? What about their ability, again, to go to the bathroom, right? that can be embarrassing for them. It could be unsanitary for them. So all these sorts of changes in a normal sensation that for you and I, we notice right away, and we can kind of adapt and adjust. For the elderly, it's a little bit more difficult because they have other things going on that all sort of tie into it. And what about pain? Okay, if you've been doing EMS for a little bit, you might have noticed that sometimes elderly patients, their perception of pain is different than you and I, right? They actually seem to have a much higher pain threshold sometimes because things just don't hurt as much as they used to, okay? And that's something to kind of think about when you're dealing with those elderly patients. Oh, their arm is a little bruised, but they're not really complaining of a lot of pain, so it might not be broken. No, that's not necessarily the case because they might not be having that same pain perception that you or I might have being younger. Just something to think about, something to look at, and remember this stuff when you're taking exams, okay, and when you're assessing your elderly patients. Guys, want to really kind of wrap it up here and talk about your general assessment. We're going to get more into some physical exam stuff and management in another video, but I want to talk about general assessment. You know, you might be the only person who's might have seen this elderly patient in a long time. All right, so take a few minutes, assess their ability to care for themselves, assess their activities of their daily living, their ability to thrive, their ability to communicate, to ambulate, all that type of stuff. This way, if you see something that's not quite right, that might be a danger to them when they're on their own, you might want to pass that information along to the hospital, okay, or maybe get a hold of a family member and let them know what's going on, okay, because sometimes they're not even aware of it, and you might be that only point of contact, right, that's actually making contact with this patient in quite a while. So keep that stuff in mind, guys, when you're doing your general assessment of these patients. Guys, I hope you can use these minutes, guys, and if something clicks here, please engage with me on social media. You can get me on Twitter. You can get me on Facebook. You can get me on Instagram. Facebook, I am at facebook.com/the EMS professional. And on Twitter and Instagram, my handle there is EMS Safe. Go check me out there, guys. Love to interact with you. I do a little something different on each one of those channels. I think you might find it interesting. Guys, listen, I don't know if you know about the main site at emsseo.com. You can get a lot more free help there, low-cost help and resources to help you pass exams. Great stuff there for study help, including videos and audios, and even more stuff there to increase your knowledge base. Presentations, free downloads you can get, and of course things like Paramedic personal hard drive. Go to emsseo.com. You can do a search there and find out anything you want. Remember that SEO stands for your success, your education, to lead you to opportunity in EMS as a whole. All right, guys, that's it for me. Again, I hope you can use these minutes, guys, that it makes sense to you what's going on here, what I'm talking about, and that you can use these when you're taking your exams, when you're interacting with your patients and other healthcare providers. If you got some minutes of your own, send them over to me. My email is contact@emsofficehours.com. And don't forget that if you're watching this on YouTube, go to the blog, go to emsofficehours.com, see the previous episode, some of the blog posts there. I think you'll find it very interesting. Leave me some comments there, some interaction there as well. All right, guys, that's it. Again, as always, Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.